You take off your shoes after a long day, and for a moment you just look at your feet. You have not really looked at them in months, maybe years. And now that you're looking, you notice things. The skin on your heels is dry and cracked, deep fissures that catch on your socks. There are small reddish dots scattered across your lower legs that you do not remember being there before. Your toenails have thickened and yellowed. The veins around your ankles seem more visible than they used to be, bluish and branching like tiny rivers. You assume this is aging. You assume feet just deteriorate. You assume none of this matters because feet are feet, the forgotten part of the body that carries you around and asks for nothing in return. But what if your feet have been asking for something? What if those cracks and colours and changes are not random signs of wear but specific messages from an organ you rarely think about? An organ sitting quietly in your abdomen, processing everything you eat and drink, filtering your blood 500 times a day, and slowly, silently, struggling under a burden you never knew you placed on it. Your liver does not have pain receptors inside its tissue. It cannot hurt the way a muscle hurts or a joint aches. It can swell to twice its normal size and you might feel nothing at all. So when the liver is stressed, when it is congested or fatty or inflamed or losing function, it cannot scream. It has to whisper. And one of the places it whispers loudest is the place furthest from your heart, the place where circulation is most challenged, the place where problems show up first because the blood has travelled so far to get there. Your feet. This is not about diagnosing yourself. I want to be clear about that from the beginning. What I am going to share with you today cannot replace blood tests and imaging and medical evaluation. If you suspect liver problems, you need to see a doctor. But what this information can do is help you notice patterns, recognize early clues, and understand connections that most people miss entirely. Your feet might be showing you something that your liver cannot tell you directly. Learning to read those signs could prompt you to investigate further, to ask the right questions, to catch a problem before it becomes serious. Because here is the uncomfortable truth. Liver problems are incredibly common and almost always silent in their early stages. Fatty liver disease now affects roughly 1 in 4 adults in many countries. Most of them do not know it. They have no symptoms. Their blood work might still look normal. They feel fine, or at least fine enough. And meanwhile, their feet are changing in ways they dismiss as cosmetic or inevitable. Let me explain why the feet and lower legs are such reliable messengers for liver health. It comes down to anatomy and physics. Your heart pumps blood outward, and that blood must travel all the way down to your feet and then return against gravity back to your heart. This return journey is the hardest work your circulatory system does. The blood in your feet has travelled the maximum distance from your heart, which means any systemic problem, any weakness in circulation, any fluid imbalance, any vascular stress, shows up there first and shows up most clearly. The liver plays a crucial role in this system that most people do not understand. The liver filters all the blood returning from your digestive tract. It produces proteins that regulate fluid balance throughout your body. It metabolizes hormones that affect your blood vessels. It processes toxins that, if accumulated, damage vascular tissue. When the liver struggles, the entire circulatory system feels the effects, and because the feet are at the end of the line, they display the consequences most visibly. Let me walk you through what to look for, starting with the skin itself. If you notice red or brown dots appearing on your lower legs and feet, particularly small spots that look almost like tiny freckles or pinpoint marks, this can indicate circulatory stress with a liver connection. These spots often represent small amounts of blood leaking from capillaries, a phenomenon called petechiae when they are very small, or purpura when they are slightly larger. The liver produces clotting factors, proteins that help your blood form clots appropriately. When liver function declines, clotting factor production decreases, and blood vessels become more likely to leak. You might also notice that you bruise more easily than you used to, that small bumps leave marks that last for weeks. This is the same mechanism. The liver's reduced ability to produce what your blood needs to maintain vascular integrity. The colour of the skin on your lower legs can also change in ways that point toward liver stress. A brownish discoloration, particularly around the ankles, sometimes indicates hemosiderin staining, which occurs when red blood cells leak from vessels and break down, depositing iron-containing pigments in the skin. While this can have multiple causes, chronic venous insufficiency exacerbated by liver congestion is one of them. The skin may also become shiny or appear thinned, a sign that circulation has been compromised long enough to affect the tissue's normal structure. These changes overlap significantly with diabetes and metabolic conditions, which is important to understand because the liver is often involved in those conditions too. Insulin resistance, the precursor to type 2 diabetes, is intimately connected to fatty liver. The two conditions feed each other in a vicious cycle. So when you see circulatory changes in your lower legs, you may be seeing the downstream effects of a metabolic and hepatic problem that has been developing silently for years. Now let's talk about veins, specifically the small spider veins that appear on the legs and sometimes on the upper body and face. Spider veins look like tiny branching networks, reddish or bluish, spreading beneath the skin like delicate webs. Most people consider them purely cosmetic, a nuisance that comes with age or genetics. But spider veins can tell a different story when they appear in certain patterns or alongside other symptoms. In clinical medicine, there is a specific sign called spider nevus, or spider angioma. It looks like a small red dot with fine blood vessels radiating outward from the centre, resembling a spider. When these appear on the upper body, particularly the chest, shoulders and face, they are considered a classic sign of liver disease, particularly cirrhosis. They occur because the damaged liver cannot properly metabolize estrogen. Yes, estrogen. Both men and women have estrogen circulating in their blood, and the liver's job is to clear it after it has done its work. When the liver is impaired, estrogen accumulates. Excess estrogen has a specific effect on blood vessels. It dilates them. It makes them more visible and more prone to forming those spidery networks. This is why spider veins can sometimes indicate not just local vascular weakness, but systemic hormonal imbalance caused by liver dysfunction. The same mechanism contributes to varicose veins, those larger, bulging, rope-like veins that many people develop in their legs. Varicose veins have multiple causes, including genetics and prolonged standing, but estrogen dominance from liver congestion can accelerate their development and make them worse. If you are noticing increased spider veins or varicose veins alongside other symptoms, particularly if you are a man noticing these changes, the liver deserves investigation. In men, elevated estrogen from poor liver clearance can also cause other symptoms: breast tissue enlargement, reduced testosterone effects, changes in fat distribution. The feet and legs are just one piece of a larger hormonal picture that the liver orchestrates. Now look at your heels. Run your finger along the edge where the skin is thickest. Are there cracks? Are the fissures deep enough to sometimes bleed? Do they catch on fabric and feel rough no matter how much cream you apply? Cracked heels are so common that most people consider them normal, just something that happens. But persistent, severe cracked heels often indicate a nutritional problem, and the liver is frequently at the centre of that problem. Your liver produces bile, a substance essential for digesting and absorbing fats. Without adequate bile, you cannot properly absorb fat-soluble vitamins, specifically vitamins A, D, E, and K. You also cannot properly absorb the essential fatty acids, the omega-3s and omega-6s that your body cannot manufacture and must obtain from food. When bile production is reduced or bile flow is obstructed, these critical nutrients pass through your digestive system without being captured. You eat them, but you do not absorb them. Your cells, including your skin cells, never receive them. The skin on your heels is the thickest skin on your body. It requires significant nutritional resources to maintain itself, to stay flexible, to regenerate the layers that wear away with every step. When fat-soluble vitamins and essential fatty acids are deficient, this thick skin cannot maintain its integrity. It dries, it cracks, it splits. No amount of external moisturizer fully solves the problem because the problem is not external. The skin is being starved from within. Vitamin B3, also called niacin, is another nutrient whose deficiency manifests in the skin, including the skin of the feet. Severe B3 deficiency causes a condition called pellagra, characterized by dermatitis, diarrhea, and dementia. The skin changes of pellagra often appear first in sun-exposed areas and areas of friction or pressure, which includes the feet. You do not need full-blown pellagra to experience milder effects of B3 insufficiency, and since the liver plays a role in converting the amino acid tryptophan into niacin, liver dysfunction can contribute to suboptimal B3 status. Omega-3 fatty acid deficiency, which we already touched on through the bile absorption connection, particularly affects skin quality. The skin becomes dry, rough, and prone to cracking. Many people supplement omega-3s but see no benefit because their liver is not producing enough bile to absorb what they are taking. They swallow capsules that pass right through them. Addressing liver function often makes omega-3 supplementation suddenly effective, because finally the body can actually use what it is receiving. If you experience itching on your feet, particularly on the soles, and you cannot identify any fungal infection or allergic cause, consider the liver. Itching is one of the most common symptoms of liver dysfunction, and while it often affects the whole body, it can concentrate in certain areas. The soles of the feet and the palms of the hands are classic locations for liver-related itch. This itching occurs because of bile backup. When the liver is congested or when bile flow is obstructed, bile components accumulate in the blood. One of these components is bilirubin, which causes jaundice when it rises high enough. But before bilirubin reaches jaundice levels, other bile salts can build up and deposit in the skin, triggering histamine release and intense itching. This itching tends to be worse at night, and is not relieved by typical anti-itch creams because it originates from inside, not outside. Pain in the feet that gets attributed to plantar fasciitis or other structural diagnoses sometimes has an inflammatory component related to liver function. The liver processes inflammatory mediators, and when it is overwhelmed, systemic inflammation increases. This inflammation does not just affect major joints, it can affect the fascia, tendons, and connective tissues throughout the body, including the feet. People undergo physical therapy and get custom orthotics and stretch religiously, and while these interventions might help somewhat, the pain persists because the underlying inflammatory burden has not been addressed. The problem is not primarily mechanical, it is metabolic. Hot feet are another symptom that people rarely connect to the liver. This is the sensation that your feet are burning, radiating heat, uncomfortable under blankets at night. You might stick your feet out from under the covers seeking cool air. You might press them against cold floors for relief. This heat sensation can have multiple causes, including neuropathy from diabetes, but liver stress is one of them. When the liver is overloaded with toxins, when its detoxification capacity is exceeded, the body looks for alternative routes to expel waste. The skin is one such route. Increased metabolic activity as the body tries to process what the liver cannot can create sensations of heat, particularly in the extremities where blood pools and circulates more slowly. This brings us to foot odor, a subject people are embarrassed to discuss but which carries real information. Smelly feet beyond what normal sweating would produce can indicate a detoxification system under strain. Your body has several routes for eliminating toxins. The liver processes them for excretion through bile into stool, the kidneys filter them into urine, the lungs exhale volatile compounds, and the skin sweats them out. When the primary routes are overwhelmed, the secondary routes pick up slack. The skin, including the skin of the feet, starts eliminating more waste products than usual. The odor that results is not just sweat, it is concentrated metabolic byproducts that should have left the body through other channels. This is why foot odor often worsens in people eating poor diets high in processed foods and low in vegetables. The liver is congested, the colon is sluggish, the kidneys are stressed, everything backs up and the feet become an exhaust vent for a system that has run out of proper exits. Improving liver function, improving elimination through better diet and hydration, often reduces foot odor as a pleasant side effect. Fluid retention in the lower legs and feet, medically called edema, is another sign that points toward liver involvement. If you press your finger into the skin of your ankle or shin and the indentation remains for several seconds before slowly filling back in, this is called pitting edema. It indicates that fluid has accumulated in the tissue, and while there are many causes including heart failure and kidney disease, liver dysfunction is high on the list. The liver produces a protein called albumin, which helps keep fluid inside blood vessels through osmotic pressure. When albumin production decreases because the liver is damaged, fluid leaks out of the vessels and into the tissues. This fluid follows gravity, pooling in the lowest parts of the body. Feet swell, ankles thicken, socks leave deep impressions that take minutes to fade. By the time edema becomes visible, there is often significant liver impairment. This is not an early sign. This is the liver asking loudly for attention after whispering was ignored. Fungal infections of the toenails, that thickening and yellowing and crumbling that seems impossible to eliminate, are usually treated as a local problem. Doctors prescribe topical antifungals. Sometimes they prescribe oral antifungals, which work better but carry risks. The infections clear temporarily, then return. They return because the underlying conditions that allowed fungal overgrowth were never addressed. Fungal and yeast overgrowth are systemic issues reflecting the state of your internal terrain. your gut microbiome, your immune function, your blood sugar levels, your liver's ability to manage the fungal population that always exists in small amounts. All of these determine whether fungi stay in check or proliferate. When the liver is struggling, when gut health is compromised, when the immune system is distracted by chronic inflammation, fungi seize the opportunity. They colonize toenails. They appear as dandruff on the scalp. They manifest as skin conditions like psoriasis or seborrheic dermatitis. You treat each location separately without realizing they share a common origin. Addressing gut health and liver function often clears fungal issues that resisted years of topical treatment. The toenails grow out clean. The dandruff disappears. The skin calms, not because a more powerful antifungal was applied, but because the body regained its natural ability to control fungal populations. Now look at your toenails more closely beyond any fungal changes. Look at the nail bed, the pink area beneath the nail itself. Is it actually pink, or has it become pale, whitish, lacking the healthy colour it should have? Pale nail beds indicate poor circulation, insufficient blood reaching the nail matrix to give it colour. While anemia can cause this, so can the circulatory compromise that accompanies liver dysfunction. The blood is not carrying adequate oxygen and nutrients to the extremities. Look for the lunula, the small half-moon shape at the base of each nail where it meets the cuticle. The lunula should be visible on most nails, most clearly on the thumbs. If the lunulae have disappeared, if they are no longer visible even on the thumbnails, this can indicate circulatory insufficiency that has been present long enough to affect nail growth. Some practitioners consider absent lunulae a sign of low vitality, of metabolic processes that have slowed. The liver's role in overall metabolic function makes it a relevant suspect when this sign appears. Having walked through all these signs, let me now address why the liver might be struggling in the first place. Liver problems do not appear randomly. They develop in response to specific burdens placed on the organ over time. Understanding these root causes helps you understand what to change. Medications are a significant contributor. The liver metabolizes almost every drug you take, prescription and over-the-counter alike. Pain relievers like acetaminophen are processed by the liver and can damage it when taken in excess or combined with alcohol. Statins for cholesterol stress the liver. Antibiotics stress the liver. Even supplements can stress the liver when taken in quantities the organ must work to process. This does not mean all medications are bad, or that you should stop prescribed treatments. It means the cumulative burden of multiple medications over years takes a toll that rarely gets discussed. Sugar, particularly in the form of high fructose corn syrup found in soft drinks and countless processed foods, directly causes fatty liver. We covered this in detail in a previous discussion about sugar, but it bears repeating here. Fructose is metabolized almost exclusively in the liver. In large quantities, it overwhelms hepatic processing capacity and gets converted to fat that deposits within liver tissue. You can develop fatty liver without ever drinking alcohol simply by consuming the amount of sugar present in a typical modern diet. Processed foods beyond just sugar contribute to liver burden through the chemicals, preservatives, artificial colours, and flavour enhancers they contain. Each of these substances must be processed by the liver. Each one adds to the queue of tasks the liver must complete. The liver is remarkably resilient, but it is not infinitely so. Feed it enough foreign substances and eventually it falls behind. Pasteurized, processed foods also lack the enzymes present in raw foods. These enzymes assist with digestion, reducing the burden on your own digestive organs and on the liver, which must deal with incompletely digested food particles that make it past the gut barrier. A diet devoid of raw vegetables, of fermented foods, of living foods with their enzymes intact, places everything on the liver's shoulders. Alcohol is the classic liver toxin and deserves mention, even though most people already know this connection. Even moderate alcohol consumption requires liver processing. Heavy consumption over years causes inflammation, fatty deposits, scarring, and eventually cirrhosis. The progression can take decades, during which the feet and legs may be showing signs that the liver itself cannot yet produce in blood tests. Excessive protein intake is a contributor that surprises many people. Protein is essential, but more is not always better. When you consume more protein than your body needs for maintenance and growth, the excess must be processed. Protein metabolism produces nitrogen waste, primarily in the form of ammonia, which the liver converts to urea for excretion by the kidneys. Very high protein diets, particularly when combined with already compromised liver or kidney function, can accelerate damage. This does not mean protein is bad. It means context matters. Someone with early liver dysfunction might benefit from moderating protein intake temporarily while supporting liver healing, then resuming normal intake once function improves. So what can be done? How do you support a liver that has been quietly struggling, whispering its distress through your feet while you looked the other way? If liver or kidney damage is already present, confirmed through testing, protein moderation often helps. This does not mean protein deficiency. It means eating adequate but not excessive amounts, roughly matching your body's actual needs rather than the inflated recommendations popular in fitness culture. This reduces nitrogen burden on organs that are already struggling to process waste. Vegetables become crucial. Vegetables provide antioxidants that protect liver cells from damage. They provide fiber that supports elimination through the colon, reducing the load of toxins the liver must process. They provide enzymes when eaten raw that assist digestion. They provide folate and other B vitamins the liver needs for its detoxification pathways. A diet high in vegetables, particularly leafy greens, cruciferous vegetables like broccoli and Brussels sprouts, and colourful vegetables rich in antioxidants directly supports hepatic healing. Bitter foods specifically stimulate bile production and flow. Arugula, dandelion greens, radicchio, artichoke, these bitter vegetables signal the liver to produce bile and the gallbladder to release it. For someone whose fat-soluble vitamin absorption is compromised by poor bile flow, adding bitter foods to meals can begin to restore that function. The cracked heels that would not heal, the dry skin that no lotion could fix, might finally improve once bile flow increases and those vitamins and fatty acids actually reach the cells that need them. The overall dietary framework that seems to help liver issues most effectively combines reduced sugar intake, moderate protein, abundant vegetables, and enough healthy fat to stimulate bile release without overwhelming the system. What some people call a healthy ketogenic diet fits this description, though the label matters less than the substance. The key elements are the elimination of refined sugars and processed carbohydrates that drive fatty liver, the inclusion of nutrient-dense whole foods, and the emphasis on vegetables that is sometimes missing from poorly formulated low-carbohydrate diets. Intermittent fasting provides another powerful tool for liver support. When you eat constantly, your liver works constantly. When you provide regular periods without food intake, the liver gets time to process its backlog, to complete detoxification tasks that kept getting pushed aside by incoming nutrients, to repair cellular damage. Fasting does not need to be extreme. Simply extending the overnight fast, eating dinner earlier and breakfast later, can provide 12 to 16 hours during which the liver can focus on restoration rather than digestion. The combination of dietary changes and time-restricted eating often produces noticeable improvement in liver function markers within weeks to months. More importantly, it produces changes you can see and feel. The swelling reduces, the itching fades, the skin begins to heal, the feet, which had been displaying distress signals for years, start to quiet down as the liver finally receives the support it needed. This does not happen overnight. The liver is resilient but not fast. Damage that accumulated over decades does not reverse in days. Patience is required. Consistency is required. The willingness to maintain supportive habits even before visible improvement appears is required. But the liver does heal when given the chance. Fatty liver can reverse completely with dietary changes alone. Early fibrosis can stabilize and sometimes improve. Even more advanced damage can stop progressing when the insults stop arriving. What your feet have been showing you is not a sentence. It is an opportunity. The cracked heels, the spider veins, the discoloration, the swelling, the fungal infections, the itching, the changes in your nails, these are early warnings, not final verdicts. They are the liver asking for help in the only language it has available, the language of the body's extremities where problems show up first. Most people ignore these signs because they do not know they are signs. They think feet just get worse with age. They think cracked heels are about the weather. They think spider veins are genetic destiny. They think toenail fungus is just bad luck, and so they miss the message. They miss the chance to intervene early, to support an organ that was struggling silently, to prevent the progression from early dysfunction to serious disease. You do not have to miss that message. Now you know what to look for. Now you know what these signs might mean. Now you know that your feet are not just carrying you through life, but communicating with you about the life happening inside your body, particularly inside an organ you cannot feel and cannot see, but which influences everything. The liver filters your blood, it regulates your hormones, it produces the bile you need to absorb essential nutrients, it processes every toxin you encounter, It manufactures the proteins that keep fluid in your blood vessels where it belongs. It manages cholesterol and blood sugar and clotting factors and inflammatory mediators. It is the silent workhorse of your metabolism, asking for nothing, receiving little attention, struggling under burdens you place on it without realizing. And when it struggles enough, it sends messages to your skin, to your veins, to your nails, to your heels, to every extremity where problems become visible before they become dangerous. Your feet are the messengers. They have been talking to you for years. The question now is simple. Will you listen? Will you investigate? Will you support the organ that supports everything else? The changes you make today determine the messages your feet send tomorrow. They can continue to warn, or they can finally quiet down, showing not distress but health, reflecting not a liver struggling but a liver healing. Look at your feet tonight. Really look at them. Notice what they are showing you, and then decide what you are willing to do about what you see. Your liver cannot ask for help directly, but through your feet it has been asking all along.